So this is a very common x-ray for us. We do this type of x-ray all the time. This is a lateral foot. It's a lateral left foot. And there's various things that doctors want to view when they order this. In this particular case, they're looking at the calcaneus. Its combining form is calcaneo, and it is the heel bone. Calcaneal means pertaining to the calcaneus. So an interesting bone. This is an odd, irregular shaped bone, and that's the category it's in. It is a bone. If you think about this, every step you've taken your entire life has started out by the calcaneus articulating with the earth as you take the step. So watch yourself as you walk. Heel comes down first. Every step you take and all the weight of your body is supported not only by the hip bones and the hip joint, but by the femur, and then below the tibia fibula, you have this calcaneus. And this is a really hard bone to fracture. I would say probably one of the most interesting cases I've ever seen of a calcaneus was a young man. I think he was 17 or 18 years old, was at a house party where there was a swimming pool and a two-story building next to it. And he thought, after having tried alcohol for the first time, kind of overdid it, thought it would be a good idea to try to jump into the swimming pool off the roof of the house, missed the swimming pool, hit the edge of the pool, and shattered both of the calcanei. So he had bilateral calcaneal fractures. And it required a lot of surgery, a lot of pain. And his x-rays are really interesting because when you see him, you see screws and nuts and bolts and everything tying that calcaneus together. He absolutely shattered them. I asked him, what his pain level was like. And he said, it's pretty bad. And he was a very young man. And that kind of injury is not going to get better with time. So don't be jumping off buildings into swimming pools. You never know. You might miss it and hit the edge. And the next thing you know, you got a situation like that. And that's going to be with him for a long, long time, unfortunately. However, from the RadTech side, those were really interesting x-rays to be able to take. Tarso, combining form for the tarsus. These are the 7 bones of the ankle, just like the wrist. We have these irregular shaped bones that help for rotational movement. And the tarsus are responsible for that movement in the ankle. Tarsal means pertaining to the ankle. Once again, there's 7 of them. Each has their own name. You will not have to learn them in this class, but you will learn them in anatomy if you are going to pass that class successfully. And just like in the wrist, we have the carpals and the metacarpals, and the meta means beyond. In the foot, we also have the tarsus and the metatarsus. So metatarso is the combining form. The metatarsals are pertaining to the foot bones. So these are the long bones that stretch out that support the majority of the foot. The metatarsals, once again, the bones that lie beyond the tarsals. Okay, so one of our general words that we haven't even talked about in this lecture at all is the actual combining form for bone in general, and it's osteo. And you can connect a lot of suffixes to it. Here's an example of some of those. Osteogenesis is formation of bone. Osteopathy is a disease of the bone. Osteitis is inflammation of a bone. Osteodynia or ostealgia is pain in the bone. Osteotomy is incision of a bone. Osteorrhaphy is suture of a bone, in other words, wiring bone fragments together. When we talk about suturing bone, of course, they don't use normal sutures. They use wire to tie things together. And osteosclerosis, which is an abnormal hardening of the bone. You would think that's actually a good thing, but if your bones need to have a little bit of flexibility, if they become abnormally rigid, they can fracture much more easily, and it can be pathogenic. So osteosclerosis, although we want our bones hard and rigid, we don't want them too hard and rigid. That means they can also shatter like glass, and that's not something we want. There are medical disorders of the bone, pathologies that cause osteosclerosis, and in those situations, people often shatter bones very easily. The opposite of that, of course, would be osteomalacia, and that's considered to be rickets. It's a softening and typically a bending of the bones. We usually see it in children because it's a very early onset, and it's very often caused by a vitamin D deficiency. We don't see it in the United States very often, although there are areas of the country where rickets is still a thing, and you can still see people who have the manifestation of this disorder. But we don't see it an awful lot anymore because it's something we're aware of, and they discovered long ago how to prevent it. So we don't see it as much. We have a few suffixes here. We're going to use osteo to tie them together. So we have osteocyte, which is a cell. Osteoblast is an embryonic cell. And osteoclast is a cell that breaks things down. So it's literally in that order. If you have a bone fracture your body is going to produce osteoblasts to try to repair that fracture in the bone. It'll produce a lot of osteoblasts that will turn into osteocytes. In fact, it'll produce so many osteoblasts that turn into osteocytes that if the body will overdo it, it'll actually create more cells, more bone cells there than you need to repair it. And it does that to protect that joint. And over time, the body will start breaking that excess mass of bone down so it begins to look like the normal bone again. And this particular process of bone healing lasts for years. And this is when the osteoclasts will come in and they'll start breaking down those excess bone cells until the bone looks more like it would have before it was fractured. It'll never look exactly the same, but it will reduce the size of what's called the callus. The callus is what kind of holds the bone together. Osteoclasts will reduce that size down over time. So, as far as the bone repair, that's usually 6 to 8 weeks, and then you put another 8 or 10 weeks onto that, especially for adults, before that bone is really ready to go and be challenged again. And then over time, like I said, years, osteoclasts will work to reduce that over-repair job your body does and get it down to a normal size. We also have something called osteoporosis. Osteo meaning bone, porosis meaning porous. So this is an abnormal condition of porous bones. This is called referring to bone density. It's an increase in porosity. Bones become brittle and increase risk of fractures. Many of us have heard stories about old people falling and breaking a hip. Any orthopedist will tell you in most cases that's not what happened. In most cases they'll say what happened is the hip broke and the patient fell. The primary place where that happens is the femoral neck, and you see that depicted here. 2 diagrams. The one on the left shows healthy bone. So you can see that matrix of spongy bone in there that's really strong and rigid, and although it has holes, there's structure to it, and that keeps it nice and strong. Osteoporotic bone is on the right, and there you can see that matrix is broken down. So osteoporosis is something that happens as a result of aging. So if you live long enough, it's going to happen. But it's also increased dramatically by things like smoking. So people who smoke have 2 times the rate of osteoporosis as people who don't smoke. Vitamin D deficiency can cause some of it. One of the big factors is a sedentary lifestyle. People who don't move around a lot, their bones tend to say, well, I guess you don't need me, so they start to kind of deteriorate a little bit. And that can be a form of osteoporosis. When astronauts go into space, the lack of gravity causes osteoporosis to onset. Now, when they're young and healthy and say under 50 or 60 years of age, you can come back to Earth and you can rebuild that bone matrix, right? But after a certain age, it doesn't rebuild very well. And that's why we see so many hip fractures in elderly people. And having said that, it makes it sound like this is the fault of the patient themselves, but it's not. Osteoporosis sometimes just happens because it just happens like anything else. There's not really an example. I just wanted to give you an idea of a few things that cause it and consequently ways to prevent having it. Another type of connective tissue tumor we mentioned in the last one, we had the, well, I think it was actually the same suffix, wasn't it? It was sarcoma. Osteosarcoma. Yeah, we did cover this word. It's a malignant tumor of connective tissue. So it's a malignant bone tumor, essentially. This image you see here on the left is a CT image. That's an isolated CT image of an osteosarcoma. That illustration in the middle kind of shows what an osteosarcomic knee would look like. And on the far right, they're kind of showing you how the tumor grows in through the outside portion of the muscle and down into the actual spongy part on the inside. Okay, so we have myelo, and this is our term for bone marrow. Milogenesis means formation of bone marrow. Poiesis, formation once again. Erythropoiesis is a formation of red blood cells, and leukopoiesis is a formation of white blood cells, and that all happens as a result of milogenesis. So what we're talking about here is the aspect of, or the idea that bone marrow produces blood cells. There's an entire cascade, and they have it illustrated here. It starts with a stem cell, and it goes into the lymphoid stem cell and the myeloid stem cell, erythroblast and megakaryoblast. And you will learn this. Once again, this is anatomy, physio type stuff. We're not going that deep. I want you to just know the words. Erythropoiesis, formation of red blood cells. Leukopoiesis, formation of white blood cells. And of course, we know the spine is made up of various bones called vertebrae, or vertebra, if they're singular. And vertebro is the combining form. So if vertebrae, once again, is a singular vertebrae, one section of the entire spine. Vertebrae is the plural, referring to more than one, and we almost always talk about the spine in terms of vertebrae, very rarely in terms of vertebra, unless there's an actual pathology on just one section. Vertebral is pertaining to a vertebra. Intervertebral is between two vertebrae. Vertebrocostal is pertaining to pertaining to a vertebra and a rib. It's where they articulate in the posterior part of our bodies. And vertebrectomy is excision of a vertebra. We also have the lamina. So lamina is part of a vertebra. It's a part of the actual arch in the back of it. And sometimes, because of calcification of the bone, so there's bone growth going on there in later years of life that isn't really supposed to be happening, it can pinch off these tiny nerve endings that are coming out from the vertebrae. So spinal cord descends, as you know, through the spine, and nerves radiate out from there, and they innervate the entire body that way. That's the structure they function on. Well, they leave the spine in a portion where the lamina is connected to them, or not connected to them, but located near them. And when they start to calcify, the passage becomes more narrow. It puts pressure on the nerve, and a laminectomy, an excision of the lamina, may be necessary. So that's where they're going to go in and surgically remove all or part of the bony arches that support the vertebra. Now, it doesn't really make it weaker because they do it in such a way that it shouldn't affect the strength of the spine, but it could. And it's a very important procedure for people who have chronic nerve back pain, and it's dealing with the calcification of those openings where the nerves come out. Spondylo is also referring to a vertebra, and this is a very common term we use in radiology. Spondylitis is inflammation of the vertebrae. Spondylodynia is pain in a vertebra. And spondylopathy or spondylopathy is a disease of the vertebrae. So you can see they kind of show it here. In radiology and in orthopedics, we call them spondies. And it's just it's a shortened form for us to be able to describe what's going on. And what it really basically means, and you can see it in this diagram here, we have healthy spine on the left, spondylitis on the right. Look at the anterior aspect of the healthy spine. See how it has a nice space and a disc space in between the vertebra are just nice and even. And then look at the diagram, pardon me, that's on the left. And look at the diagram on the right, that's spondylitis. You can see those vertebrae are actually starting to fuse together, which means decreased flexibility in the spine. It can be very painful. And spondylo, referring to vertebrae, once again, we have spondylolisthesis. This is a forward displacement of a lower vertebra. So you see that here. This is a slipped disc, or a slipped vertebra is another word for it. So the displacement of a lower vertebra over the vertebra below it, most commonly L5. So that's that L5-S1 joint I was talking about earlier. This is typically what happens. The very last vertebra in the spine slides off of that sacral prominence. It pinches the spinal cord it does not pinch the spinal cord because the spinal cord doesn't go that low, but it can pinch off certain types of nerves. It's also very painful. It can lead to spinal cord compression further up the spine, and it is a condition that can be treated. Once again, it's a surgical procedure that they're going to use to straighten that out. Okay, I'm going to pause here and come back and have just a few more slides for you, and that will complete all of our slides for the musculoskeletal system. So sit tight. I'll be right back with you.